I am Dr. Rebecca Sloan, an endocrinologist and specialist in male reproductive longevity and vascular mechanics. Over the past several months, I have witnessed a massive, entirely unverified trend aggressively take over the internet. Millions of older men are suddenly waking up, heading into their kitchens, and forcing themselves to chew and swallow harsh, burning pieces of raw ginger root. They are doing this because they have read articles or seen viral videos claiming that raw ginger is a miraculous natural cure for erectile unpredictability and a guaranteed way to restore their morning erections. Almost daily, patients in their 60s and 70s sit in my clinic incredibly frustrated. They tell me they have been diligently eating raw ginger every single morning for weeks. They endure the intense acid reflux, the gastrointestinal burning, and the sharp taste, entirely convinced they are healing their vascular system. Yet their bedroom performance remains completely stagnant. They have experienced absolutely zero improvement in their erectile rigidity, and they are left feeling confused, wondering if their bodies are simply too old or too damaged to respond to natural treatments. Today, we are going to look strictly at the clinical pharmacokinetics of your digestive system. I am going to explain exactly why eating raw ginger alone is a biological waste of time for your erections, and how a highly specific biological trap inside your liver is destroying the active compounds before they ever reach your pelvic floor. Most importantly, I am going to reveal the exact, scientifically backed liquid you must combine with your ginger to bypass this trap, force the active molecules directly into your bloodstream, and trigger the powerful vascular dilation you are desperately seeking. To understand why this internet trend is failing you, we must briefly review the microscopic mechanics of how an erection actually functions. An erection is not a simple mechanical switch. It is a complex, high-pressure hemodynamic event that relies entirely on the health of your blood vessels. Inside your anatomy, there are two spongy cylindrical chambers known as the corpora cavernosa. The interior lining of the microscopic blood vessels inside these chambers is called the endothelium. When your body requires an erection, these endothelial cells must instantly release a vital gas called nitric oxide. Nitric oxide is the master biological vasodilator. It floods the surrounding smooth muscle, forcing it to relax rapidly. This relaxation allows a massive, high-pressure surge of blood to rush into the pelvic arteries, engorging the tissue, compressing the exit veins, and creating mechanical rigidity. Without a powerful, sustained release of nitric oxide, the smooth muscle remains tightly contracted. The arteries stay narrow, and an erection is biologically impossible. The reason ginger became so incredibly popular is because, on a molecular level, it actually holds profound promise. Raw ginger contains a highly potent class of bioactive phenolic compounds known as gingerols, specifically 6-gingerol and 8-gingerol. In controlled in vitro laboratory settings, these gingerols are remarkable. They have been clinically proven to stimulate the eNOS enzyme, the specific engine inside your endothelial cells responsible for manufacturing nitric oxide. Furthermore, gingerols are aggressive antioxidants. They violently neutralize the free radicals and reactive oxygen species that cause microscopic scarring and inflammation inside your aging blood vessels. If you could magically teleport pure, unadulterated gingerol directly into the arteries of your pelvic floor, you would experience a profound, sustained vasodilatory event. Your smooth muscle would relax, and your vascular rigidity would dramatically improve. So, why is it failing when you eat it? The answer lies in a devastating biological process known as hepatic first-pass metabolism. When you chew and swallow raw ginger root, it enters your stomach and travels into your small intestine, where the gingerols are rapidly absorbed into the intestinal wall. However, this blood does not go directly into your general circulation. Evolution has designed a strict security checkpoint. All the blood draining from your digestive tract is funneled directly into the portal vein, which carries it straight to your liver for screening before it is allowed to reach your heart or your pelvic floor. Your liver is a highly efficient chemical filtration plant. When it detects these raw, unprotected phenolic gingerol compounds arriving in high concentrations, it identifies them as foreign substances. The liver immediately initiates a process called glucuronidation, aggressively breaking down and destroying the gingerols to prepare them for excretion in your urine. Clinical pharmacokinetic studies show that because of this brutal first-pass metabolism, less than 2% of the active gingerol you consume orally ever actually makes it into your systemic bloodstream intact. You can endure the terrible taste and the acid reflux of raw ginger all day long, but your liver is systematically destroying the very molecules your penile arteries desperately need. This brings us to the clinical solution. If you want gingerol to heal your vascular system, you must smuggle it past the liver. You must change the biological pathway it uses to enter your body. To do this, you must never eat raw ginger alone. You must always combine it with a highly specific lipophilic carrier, high phenolic, cold-pressed extra virgin olive oil. When you mix raw, grated ginger with a pure liquid lipid like extra virgin olive oil, you fundamentally alter the digestive mechanics. Gingerols are highly lipophilic, meaning they absolutely love fat. When mixed, the active ginger molecules dissolve directly into the lipids of the olive oil. As this mixture enters your small intestine, your body releases bile salts, which emulsify the oil into microscopic fat droplets called micelles. The vital gingerols are safely hidden inside the core of these lipid spheres. Here is where the biological magic happens. Unlike water-soluble nutrients, these lipid micelles do not enter the portal vein. They are simply too large. Instead, they are absorbed by specialized lymphatic vessels in your intestines called lacteals. By entering the lymphatic system, the gingerols completely bypass the liver and its destructive first-pass metabolism. The lymphatic fluid travels up your body through the thoracic duct and empties directly into the subclavian vein near your heart, instantly entering your systemic circulation. By simply adding this specific liquid lipid, you preserve the structural integrity of the gingerols, delivering a massive, highly concentrated dose directly to the damaged endothelial cells in your pelvic floor. You are effectively turning off the security checkpoint and flooding your vascular system with exactly what it needs to produce nitric oxide. Furthermore, high phenolic extra virgin olive oil is not just a passive carrier. It is a profound vascular therapeutic in its own right. Authentic Evo contains a powerful compound called oleocanthal. In clinical literature, oleocanthal operates as a natural, non-steroidal anti-inflammatory, mimicking the exact mechanism of ibuprofen, but without the gastrointestinal toxicity. As men age past 60, their pelvic blood vessels become chronically inflamed, stiff, and rigid. This inflammation acts like a physical straitjacket, preventing the arteries from expanding even when nitric oxide is present. When you combine the aggressive NO-stimulating power of lymphatic-delivered gingerol with the profound anti-inflammatory, tissue-softening action of oleocanthal, you create a perfect biological synergy. You are simultaneously clearing the vascular inflammation and forcing the production of the vasodilator needed to restore mechanical rigidity. The specific clinical protocol is simple but precise. You must finely grate exactly 1 tablespoon of fresh, raw, organic ginger root. You must let this grated ginger sit exposed to the air for approximately 5 minutes. This brief resting period allows specific plant enzymes to convert a portion of the gingerols into a compound called shogal, which is exponentially more potent for vascular dilation. After 5 minutes, vigorously mix the grated ginger into 1 tablespoon of high phenolic, cold-pressed extra virgin olive oil. Consume the mixture immediately, ideally in the morning on an empty stomach to maximize lymphatic absorption. Before we conclude, I must ask for your support. If you are finding this level of precise, evidence-based medical biochemistry valuable, please take a second to subscribe to the channel and like this video. This kind of detailed vascular education is rarely provided in a standard 15-minute medical consultation, yet it is absolutely critical for male longevity. By engaging with this video, you are directly helping the algorithm push this vital information to other men who are currently struggling in silence, believing their physical decline is permanent. While implementing this exact ginger and olive oil protocol will significantly upgrade your localized biochemistry, I must offer a realistic clinical caveat. If you are an older man who has been struggling with erectile unpredictability, spontaneous morning deflation, or performance anxiety for years, your vascular system is already in a state of advanced distress. You have significant endothelial scarring, severe oxidative damage, and deeply depleted internal nitric oxide reserves. In my clinical practice, I find that while nutritional protocols like the lymphatic ginger bypass are excellent foundational habits, they are rarely powerful enough on their own to reverse years of deeply entrenched vascular fibrosis and cellular aging. When a patient reaches this specific plateau, relying solely on grocery store ingredients is no longer biologically sufficient. The penile tissue requires highly standardized, concentrated biochemical scaffolding to force the dormant endothelial cells to physically repair themselves and rebuild the intricate nerve connections necessary for arousal. This is exactly why I transition my patients who are serious about their longevity away from generic kitchen remedies and onto specific, clinically vetted natural compounds that utilize advanced liposomal delivery systems. We target the exact PDE5 enzymatic pathways and endothelial repair mechanisms using standardized extracts that guarantee clinical-grade absorption without the agonizing side effects of synthetic prescription pills. I have placed the direct link to the specific, scientifically validated formulation I recommend to my own patients in the pinned comment below this video. I strongly encourage you to click that link, read the extensive clinical data, and evaluate the specific biological mechanism of action for yourself. Your vascular system possesses an incredible degree of biological plasticity. It wants to heal, and it has the capacity to regenerate, provided you stop sabotaging it with poor absorption strategies and start providing the exact, highly bioavailable raw materials it requires. Do not accept erectile unpredictability as a normal consequence of aging. Intervening with precise, targeted biochemistry today is the absolute key to ensuring your vitality tomorrow. The link is in the pinned comment below. Take control of your vascular health.